on biomaterials and different nanomaterials for developing different products for our industry. So this is our R&D center. This is actually incorporated in 1966 actually, and with the administrative control of Ministry of Health and Family Welfare. And HLL was initially started to support the National Family Planning Program of Government of India. And right now it has 7 manufacturing facilities across India, and it has pan-India marketing presence, global reach in 45 countries, and supplies to major international procurement agencies. And our business purpose is to provide high-quality healthcare products and services at affordable price. And this is our R&D center, and this is our administrative block. Coming to the research areas, like we have 3 main verticals. One is medical devices, which deals with the hospital-related products like implants. We have a product called Emily, which is actually an intrauterine device that is mainly used for arresting this intrauterine bleeding, which is commonly found in elderly women. And also it can be used for contraception. Then we work on delivery systems. Like this Emily is also a delivery system because it releases different hormone-based contraceptive agent. Then we work on nanomaterials like different zinc oxide nanomaterials, all those different types of nanomaterials. Then we have another division called pharma, which deals with it has 3 divisions. One is natural products. There are different natural products based products are developed. For example, like herbicide for this HIV, all those things are being developed. Then synthetic products where we develop new contraceptive molecules. Then formulations where the existing molecules will be formulated into different like capsules. There will be like long releasing formulations, slow releasing formulations, etc. Then we have a division called diagnostics where we develop rapid test kits based on ELISA and other molecular diagnostic kits. So I belong to the medical device division where we mainly work on different biomaterials and application in the field of tissue engineering, then for antibacterial materials, drug delivery devices, etc. So what are biomaterials? A biomaterial is a non-viable material used in a medical device. It is intended to interact with the biological systems. That means it will have interaction with the body straight away, or sometimes it will be on the outside of the body also. That is, it will be in contact with the skin. So what is a biomaterial science? Biomaterial science is the physical and biological study of materials and their interactions with the biological environment. That is, like you will develop the biomaterial, then you will do the characterization studies and also how it is interacting with the blood, then how it is interacting with the skin, then the tissues, etc. That is called toxicological studies and also followed by animal evaluations. Then just explaining about the history, that is 2000 years ago, like Romans, Chinese, and Aztecs used gold in dentistry. Then in the 20th century onwards, different implants people started using. Then in 1937, people started working on polymethyl methacrylate. Then fabrics, different synthetic fabrics started coming into picture. Then again, like different biomaterials field was solidified in the late 1960s to 1970s. And now everybody knows that biomaterial plays a bigger role in the healthcare sector. So one important factor which is coming when we talk about biological material is the biocompatibility. Biocompatibility is the ability of a material to perform with an appropriate host response in a specific application. Appropriate host response can be the resistance to blood clotting. Suppose if you are using an implant, it should not clot the blood. Otherwise, it will affect the human body. Then resistance to bacterial colonization. That is, it should not produce inflammation. Then normal and uncomplicated healing. That is, the healing should happen very smoothly. So these are the things which a biomaterial should address. So if you see biomaterials, there can be different types of biomaterials like polymers, then semiconductor materials, which can be used for biosensors, etc., like quantum dots. Then metals. Metals are generally used for dental implants. Then ceramics. Ceramics are again used in dental implants. Bone replacements. Then polymers are generally used for drug delivery. Then skin cartilage and bone regeneration. That is a section called tissue regeneration. Then ocular implants. That is for eye implants, etc. So in this talk, I'll be talking mainly on like this polymers, biopolymers, and nanomaterials. That is mainly metal nanomaterials and its application in developing antibacterial materials. Coming to the different generation of materials, like initially it was all like accidental, that is serendipity, like some materials were developed for some other applications, then later it was found that it could be used for bio application as well. Then in the second generation of biomaterials, like the material scientists used to discuss with the physicians and engineers and develop the materials. Then in the third generation of biomaterials, bio So now the third generation of biomaterials are under development. That is already different bioengineered implants are in market actually, like skin scaffolds, etc. are already in the market, and different other products are also under development. So the different examples, as I mentioned earlier, like it can be classified into different groups. One is the tissue engineering. I'll be discussing on that. I have done some work on the area of tissue engineering. Then developing antibacterial agents. That is use of silver nanoparticles as antibacterial agents for biomedical applications. Then artificial skin membranes. Again, this comes under tissue engineering. Then different hemostats. Hemostats are like blood arresting materials based on biopolymers. Then drug delivery devices. And under that, I'll be discussing some development of microparticles as well as microneedles for different applications. So coming to the first topic, that is hyaluronic acid hydrogel for the treatment of osteoarthritis. Hyaluronic acid is a biopolymer actually. It's a polysaccharide. It is actually present in our body. That is, it is present in our eye, then in the soft tissues, etc. And for different biomedical applications, generally, the scientists used to isolate hyaluronic acid from this uh, rooster combs, that corida, that red color thing on the head. That from that, people used to isolate, but it is very costly. So later, by fermentation process was optimized for developing hyaluronic acid. It's a bit costly polymer. So we used high molecular weight hyaluronic acid for developing a hydrogel for the treatment of osteoarthritis. So osteoarthritis, as you may be knowing, is the most prevalent joint disease and is the leading source of Osteoarthritis, you'll be knowing, is the most prevalent joint disease and is a leading source of chronic pain and disability in the whole world. Like as people get old, they will start feeling pain in the knees and different joints. And it is mostly found in the joints of the knee actually. Knee osteoarthritis accounts for more than 80% of the disease total burden. So, and it is the most frequent joint disease with a prevalence of 22% to 39% in India. So the treatment plans, you will be knowing that exercise is the easiest thing, then weight control, then the rest and joint care, then injections are recommended actually. Medicines like painkillers will be given. And the last method is the surgery. That is this knee transplantation. And but the problem with the knee transplantation is that it is very painful and it is very costly. So some other alternative methods are like developed. That is, before explaining that, I'll just explain why HA hydrogel is used for this particular application. This picture explains the osteoarthritic knee actually. The right side shows osteoarthritic infected knee, wherein you can see that in between that articular cartilage, that is the blue, that cap, that is the cartilage. And in between these two cartilage, there is a liquid, that is a synovial fluid, which is actually hyaluronic acid hydrogel, which is naturally found in the human body. So as we grow older, this lubrication of provided by the synovial fluid will start decreasing. Then there will be inflammation and associated pain, etc. will be observed. So HA is that is hyaluronic acid is the main component of the synovial fluid, and it gives lubricating effect for the knee joint, and it's an important modulator. That is, there are some modulators which will give rise to pain in that area. So if hyaluronic acid starts degenerates, that pain will be more. So that sensitivity also will be increased for that area. And this stabilizes the cartilaginous matrix. As such, synovial fluid is an important part of this cartilage. So in the initial phases of osteoarthritis, this hyaluronic acid will start degrading. So one of the methods suggested for the treatment is providing a hyaluronic acid intra-articular injection. That is, intra-articular injection is nothing but an injection given to the that portion of the knee. So the first report of HA hydrogel injection helping in the treatment of osteoarthritis came in 1993. It's very recent actually. And nowadays this kind of injections are available in Kerala, in India also. And this helps in relieving the pain, and also it will postpone the disease. That knee replacement surgery can be postponed. It is not the ultimate cure actually, but it will relieve the pain. So here what we have done is we developed a hyaluronic acid, high molecular weight hyaluronic acid hydrogel, and we did the physiochemical characterizations like morphological analysis, rheological analysis, swelling studies, how this degrades. Then the most important stability analysis, like how this gel can be stored for say 2-3 years. Then how it is sterilized. Then the in vivo studies in animals, such as intracutaneous reactivity studies, systemic toxicity, etc. And we found that we could eventually develop an optimized hyaluronic acid hydrogel, and sterilization was done by most heat. That is, autoclaving was optimized for the sterilization. So I will explain it. Initially, we took this hyaluronic acid and we cross-linked it using divinyl sulfone. Divinyl sulfone is the cross-linking agent which we used for developing this hyaluronic acid hydrogel. So as you'll be knowing, divinyl sulfone is having double bonds. So that will be used for cross-linking of this hyaluronic acid. And once after developing the gel, we did the rheological measurements. That is, rheological measurements are very important for hydrogels because this is acting as a lubricant, and how this will act when you give a strain or stress to this is very important. So that can be evaluated using the rheological measurements. So that was done using a cone plate geometry. at 25 degrees Celsius using an Anton rheometer. And this is actually a comparison of the rheological parameters with the healthy young synovial fluid present in humans. That is three different frequencies we have compared. That is walking frequency, 0.5 hertz, 2.5 hertz running frequency, and 5 hertz, that is jumping frequency. So we tried different formulations and we could come up with a hydrogel which is almost matching with the healthy young synovial fluid, and we optimized that formulation. And this is actually the detailed rheological analysis. First one is the storage and loss modulus. Like you will be knowing that hydrogel, when you study the rheology, you will be evaluating the viscoelastic properties mainly. That is the storage modulus, which gives an idea about how strong this gel is, and the loss modulus, which gives an idea about the liquid-like parameter of the hydrogel. So we can see that it has a very strong like storage modulus, indicating that it is very strong, like stabilized hydrogel. And again, the same modulus was monitored against time, and it is showing a comparatively stable kind of behavior. Again, the loss factor, which gives an idea about the stability of the hydrogel, was plotted, which is found to be lesser than 1. That means it is a stable, elastic kind of a material with elastic properties dominant in that. And also it shows the shear thinning behavior, which will be helpful in giving it as an injection. Then after the development, we wanted to see, we want to give it into the body. So it is very important that we find out whether some residual quantity of divinyl sulfone, that is the crosslinker, is present in the hydrogel or not. So what we did was, we determined the amount of divinyl sulfone using gas chromatography. So divinyl sulfone was diluted with absolute ethyl alcohol at different concentration, and a calibration plot was made. And HA hydrogel was like soaked in hyaluronidase. That is an enzyme which breaks down this hyaluronic acid hydrogel. And after a particular time, we took the material and we injected in the gas chromatogram, and we found that there was no residual amount of divinyl sulfone present in the hydrogel. Before that, we gave the material for dialysis for some 24 hours, so that whatever extra divinyl sulfone is present could be easily removed. Then for a product to be used, it is very important that sterility test should be passed. So different microorganisms were tested, like Bacillus subtilis, Pseudomonas, Aspergillus niger, etc. were tested. As per the standard ISO protocol, sterility test was done, and we found that there was no growth found in the hydrogel. So this was found to be sterile. Coming to one important parameter, that is the stability of the hydrogel. So when we are developing a product in an industry, the first thing they would want to know is that once after developing the prototype and optimizing the prototype, they would want to know like what is the shelf life of a product. Because if you develop a product and if it doesn't have a shelf life, like if it is it's going to be stable only for 1 month or 2 months, then it is of no use for an industry actually. It has to be stable in a proper what is that, packing material. Packing material has to be chosen, and it should be properly packed, and it should be stable for at least 1 to 2 years. Then only marketing division of an industry will take up your product. So we generally, after developing a product, we generally conduct stability evaluation, and there are lots of guidelines. ICH guidelines we follow actually. So as per that, at different temperatures and humidity conditions, because humidity plays an important role in the stability of a product. So like at a particular temperature and particular humidity, we will seal these products and we'll keep it in a shelf that is called stability chamber. It is actually a oven kind of a thing where you can monitor the temperature and the humidity, and you will store your products there. And at particular intervals of time, like 0th month, then 3rd month, then 6th month, 1 year, 2 year, you will withdraw certain number of products from that shelf, and you will evaluate. then you have to make sure that all your important parameters are not changing. Once you start seeing some change, then the product cannot be given for marketing. So this is one, actually I have not shown all the studies, whatever we have conducted. This is one important study, that is rheological parameters were checked. That is the first, at different frequencies, we checked the rheological parameters at 0th month, 3rd month, and 3rd month itself at two different temperatures, 5 degrees Celsius and 25 degrees Celsius. And it was found that when we stored the product at 5 degrees Celsius for 3 months, there was no change in the rheological parameters. But the product which was kept in 25 degrees Celsius showed a reduction in all the modulus. So that was not considered, and we optimized the shelf life, that is the storage condition, accordingly. That is 5 degrees Celsius is the storage condition for that particular type of product. So once after optimizing the physiological parameters, next we need to see the biocompatibility, like how this product is going to behave when it is going to be used in the human body. The first test is the cytotoxicity test. Any biomaterial has to be checked for cytotoxicity. So we have done it as per the ISO standard, and MCF7 cell lines were used, and as per the cell research, it's not very clear actually. This image shows round cells. That means the cells are not damaged when it is in contact with this hydrogel. So that means it is passing the cytotoxicity. Once it passes the cytotoxicity and stability analysis, we will go to the preclinical evaluations. Preclinical evaluation is nothing but the test in the animals. And it also includes test in with blood, like blood compatibility is also coming under this preclinical evaluation. So in this case, like acute systemic toxicity, that is when it is given to this rat, whether the rat's body function is changing or not, whether the kidney is functioning the same, whether the liver is functioning the same, that will be checked. Then since it is going to be given as an injection to the knee, intracutaneous reactivity test is also done. Again, all these tests are done as per the ISO standard. And we found that there was no mortality and morbidity. Actually, these are all very detailed tests. I'm not going into that much detail. Uh, but the result is that there was no toxicity found in both the cases. Then there is this intracutaneous reactivity test was done in this white rabbits. And we can see that like from this hydrogel, two types of extracts will be taken. That is, one is the saline, that is the water things, and another one is cottonseed oil. That is, both these extracts will be taken and will be given as an injection to the rabbit. And that knee part will be examined for any irritation. And it was found that there was no irritation, there was no swelling, and some amount of samples will be taken from that knee and histopathology will be checked. And it was found that there was no change. So this test also passed. So the conclusion for this work is that HA hydrogel was prepared, purified, that is by dialysis, and sterilized using, again, I didn't mention about that. Actually, this hydrogels, generally medical devices are sterilized using gamma radiation. Most of the products, whatever we use, are done by 25 kg by gamma radiation. That is a standard protocol. But these hydrogels are very soft material. So if you do 25 kg by gamma radiation, it will all break. So we had to find out some other method, and we optimized autoclaving. That is, the sterilization using steam sterilization was optimized. That is, by different variations we tried, and we took the material and we tested for sterility, and that is how we optimized the steam sterilization method. Then the stability of the steam sterilized hydrogel was evaluated for 3 months. Actually, 3 months is actually very less. It has to be evaluated at least for some 3 years. Then only a product can be set stable. And it is found to be non-cytotoxic in MCF7 cell lines. And the experiments conducted on albino rats and Swiss albino mice concluded that the material does not cause any intracutaneous reactivity and acute systemic toxicity. So again, after conducting all these things, it is important that this product be tested in humans before going to the market. So that part I am not explaining it here. So coming to the next work is that we developed some silver nanoparticles for making cellulose pulp antibacterial. Actually, we are having this cellulose pulp is generally used for hygiene products. Like it can be used in baby diapers, sanitary napkins, textiles, etc. Like you must be heard of this antibacterial shirts which are available in the market. So this was developed for that purpose actually, that is for making this cellulose pulp antibacterial. So what we did was initially we developed silver nanoparticles and we used for incorporating in cellulose pulp, and we checked different tests. But then later it was found that like we need this amount in large quantities. So we didn't make it anymore. We purchased the silver nanoparticles from a company called Resil Chemicals. They can provide us in large quantities. So we obtained from them silver nanoparticles having less size, less than 100 nanometer. And we incorporated in different quantities 0.1, 0.2, 0.3 per cellulose pulp piece. And we did different studies to see the optimum concentration which will give antibacterial property without any toxicity. Because one of the problem with silver is that it is antibacterial, but if it is provided in too much of amount, it can cause toxicity also. So it's very important that you find out the optimum concentration which will provide antibacterial activity, but it should not provide any toxicity. So that was the aim. So here we characterize the silver nanoparticles using TEM. XRD also was used. Then we developed, no, we didn't develop actually, we gave the material for testing of antibacterial activity using GIS L1902 method. This is actually a method which was developed in Japan for testing the textiles. The antibacterial activity of the textiles was tested using this GIS L1902 method. Then different cytotoxicity in vivo intracutaneous reactivity and vaginal irritation. Because this product is going to be used in diapers and sanitary napkins, vaginal irritation was checked. So we know that silver nanoparticle is non-toxic to humans if properly used. That is, if you use in a lower concentration, it is non-toxic. There are, like from ancient times, there are reports of using silver for different like treating wounds, etc. And for drinking water, people used to use this silver vessels, etc. And it is also found that silver purifies water. So nowadays also people use silver based different products for wound management, etc. Silver sulfadiazine kind of materials are used for wound materials, and even silver nanoparticle incorporated products are also Mega Heal. I think Mega Heal is silver nanoparticle based wound care material which is available in the market actually. So how this silver is affecting the microorganism? That is, it affects the outside cellular membrane. It interrupts that. And once after entering, it increases the oxidative stress present in the bacterial membrane. And also it affects the DNA gyrase, which helps in the replication of bacteria. So thereby it limits the growth of bacteria. That is how silver acts as a antibacterial material. So this is the characterization of the silver nanoparticle. As we can see, like small particles of silver can be seen in the left side, and right side is the bar diagram, histogram showing the size distribution of the particles. We can see that almost all the particles are of lesser than 100 nanometer size. And this is the GIS L1902 method, which was done on Staphylococcus aureus. And when it was done using 3 different concentrations, the test criteria for passing this test, the criteria is that bactericidal activity, when it is calculated, should be more than 2. And for all the concentrations, it was found to be more than 2. Hence, this material is passing the antibacterial activity and it is found to have percentage efficiency of greater than 99%. The same thing was found with the pneumonia also, Klebsiella pneumonia. So here also the bactericidal activity was found to be more than 2 and efficiency was found to be more than 99%. Hence, as per the ISO standards, as I told before, different toxicity evaluations were done. That is, the first it was done, the in vitro cytotoxicity was done, followed by irritation and skin sensitization. And in this particular case, since it's going to be used for developing the diapers and sanitary napkins, vaginal irritation also was done in albino rabbits. So this is the cytotoxicity evaluation, which was conducted using different dilutions of silver, and it was found that the cell viability is near to 100%, indicating that it is not causing much cytotoxicity to the cell lines used. This is the intracutaneous reactivity. As I explained earlier, the erythema and edema, that is the irritation found on the skin, is evaluated. That is, there is a scoring board that is used when it was used the saline, what is the scoring, and when it was used the cottonseed oil extract, what is the that will be tabulated for different time periods, that is 24 hours, 48 hours and 72 hours, and it was found that the irritation was found to be 0. This is again intracutaneous reactivity, the added values, and the score from 0 to 0.9 are non-irritant, and here we are having a value of 0.3. Hence, this material was found to be non-irritant. Again, this is the vaginal irritation. Again, this was found not to irritate the vaginal cell lines. This was confirmed by using histopathology evaluation. The A and B is the rabbit's vaginal skin, like with the control and with the silver nanoparticle, and it was found that it is both are having the same pattern, indicating that there is no irritation caused to the vaginal cell lines. So the conclusion is different concentrations of silver such as 0.1 gram, 0.2 gram and 0.3 gram of silver has been added to this individual cellulose pulp, and antibacterial activity of the different amounts of silver incorporated cellulose pulp was evaluated, and with the least amount of silver, that is 0.2 gram of has been chosen for different studies because it didn't create any toxic effect on the cell lines. In vitro cytotoxicity was found to be non-toxic, and in vivo cytotoxicity was also found to be non-toxic. This technology was transferred to our sanitary napkin unit in Belgaum. So it was used there for developing sanitary napkins. Again, one more work on silver nanoparticles. This work was actually done in Sri Chitra Tirunal Institute, where I worked for some period of time. So this is actually for developing vascular scaffold. Vascular scaffold is like if there is an injury happening to a vascular tube, like it cannot regenerate itself. So what is done is a polymeric membrane or metallic vascular scaffold or vascular, that tube will be put in that portion, so that it regenerates. So what is the difficulty in using metal tubes is that, like, once the original vascular that tube is regenerated, you need to remove that metal thing by surgery. But if you use some polymeric membranes, like polymeric vascular scaffolds, what will happen is, as the natural vascular scaffold develops, this polymeric membrane will degrade itself, so that we don't have to do one more surgery to remove that vascular scaffold. So one of the difficulty which is found in this kind of polymer scaffolds is that infection can happen at that point. So it is generally found in such cases. So that was the reason why we thought of developing silver nanoparticle incorporated vascular scaffolds, so that like you don't have to provide an extra antibacterial agent. So this again, in this case, silver was chosen, and silver protected with the polyethylene glycol was chosen particularly. You will be knowing, like, silver generally cannot stay as such, like it need a protecting group to stabilize. Otherwise, this nanoparticle, since it's having large surface area, like it will not be stable. So PEG is chosen because polyethylene glycol is found to be highly biocompatible. And one more reason is there that I will explain. Like, so we will be developing the silver nanoparticle protected with polyethylene glycol, and the scaffold will be that vascular scaffold will be developed using polycaprolactam. Polycaprolactam, as you will be knowing, that is a stable synthetic polymer which degrades slowly. Actually, it doesn't degrade very fast. So when you incorporate this PEG containing silver nanoparticle inside this polycaprolactam and we put it inside the body or in a medium, what is happening is that this polyethylene glycol is like hydrophilic. It dissolves in water. So since the medium is in water, this PEG will slowly dissolve into the medium, and along with the PEG, silver nanoparticle also will be giving that antibacterial activity to that surrounding medium. So that is the idea, and it will be giving pores. Once this PEG comes out from this membrane, that vascular scaffold will become porous, that it will have small pores where this PEG has come out. And that porosity is very important for the regeneration of the actual vascular scaffold, because this porous structures only this kind of natural materials grow. That is how it is. So here also we tried different concentration like 0.1, 0.2, and 0.6. And this is actually the left side is the membrane, that is the vascular scaffold is cut, and we have taken a SCM image of that membrane. And once after putting that membrane for 72 hours, we can see different pores in that right side. That is because this PEG, which contains silver nanoparticle, has come out of that membrane. So it was found that within 72 hours, maximum amount of silver comes out of this vascular scaffold. So this is one method which we use for quantifying the silver nanoparticle. That is one, as it releases, HCl will be added. So silver will react with HCl, and the HCl, that turbidity will be, AgCl turbidity will be formed. So that turbidity will be evaluated as a percentage transmittance. So we can find out the concentration. And it was found that within 72 hours, almost all the amounts of silver is getting released. And antibacterial activity was found out using the zone of inhibition assay using E. coli and Staphylococcus aureus. And as you can see, depending on the concentration, that the radius is increasing. That radius is compared with the gentamicin. Gentamicin is a antibiotic. So we can compare with the, and we can see that it is comparable. Though less in diameter, it is showing antibacterial activity. So this is actually actin stained human umbilical vein endothelial cells, scaffolds. The first one is having no silver, and second one is having 0.1, and third one is having 0.2 silver. So we can see that the 1 and 2, the cell attachment on the cells is almost the same. That is, there is not much of toxic effect is seen. But as the concentration of silver increases, the cell spreading and attachment is less. So this is actually apoptosis assay conducted on PCL scaffolds. So here also we can see that higher concentrations of silver causes cell death, whereas lower concentration doesn't show. This result is shown here. We can see that the first one, 0 silver concentration, all the live cells are more. Here we can see that with 0 silver concentrations, all the live cells are found to be more and dead cells are low. But whereas as the concentration increases, when it reaches 0.6 Ag, the dead cells are increasing. So the conclusion is that silver nanoparticles of approximately 20 nanometer was prepared A polymer scaffold containing the nanoparticles have been made and elution of silver from the scaffold was studied and quantified. Zone of inhibition was found out. Flow cytometry analysis reveals that in the cellular level, cell death happens to concentrations greater than 0.1 and especially towards the 0.6 gram of silver. Next, I will explain about some wound healing membrane, that is electrospun polyurethane gelatin artificial skin scaffold for wound healing. As you will be knowing, like native skin consists mainly of epidermis and dermis. That is, the outer layer will be called epidermis and the next inner layer is called the dermis. So the clinical management of a deep and extensive wound is very challenging, and any wound having depth more than 1 centimeter cannot heal itself. It requires graft, and getting graft from other part of the body is very difficult, and it will again give rise to inflammation and infections. So in that case, different products are already available in the market, like Integra, etc. Like that, different polymeric products are available. Like skin tissue engineering is a good option for deep wound, as there is a limitation of getting large autografts. For deep wounds such as second degree burn wounds, almost all the part of dermis and the whole of epidermis is lost. So in such cases, you can provide a material which is of two layers, that is it will mimic the original skin having two layers, that is the epidermis as well as the dermal layer. So that kind of a material can be developed using the electrospinning method. You will be knowing, no, about electrospinning. So here in this work, we have constructed an artificial skin scaffold mimicking the bilayered structure of the native skin using electrospinning technique. So polyurethane was used for developing the epidermal, that is the outside layer, and gelatin was used for developing the inner layer. The reason for choosing polyurethane was that, like, the outer layer has to provide that protection against the bacteria, etc. So we used a synthetic polymer for that outer layer, and gelatin was used for the inner layer because gelatin is actually derived from humans, not humans, like biological origin actually. It resembles the human things very closely. So that is the reason why we chose gelatin. Gelatin, you may be knowing, is extracted from this bone, cartilage, etc. Then bilayered collagen based. As of now, different products such as Integra, BioBrain, etc. are available, but they are very costly and not available in Indian market. So that is the reason why we developed this membrane. So we developed a bilayered membrane containing polyurethane as the epidermal layer. So here actually we have developed a bilayered membrane having polyurethane as the outer membrane and gelatin as the inner membrane. That is as a replacement of dermis. So and it also contains ciprofloxacin. Ciprofloxacin is an antibiotic which is used for this as an antibacterial agent, etc. Then after developing this membrane, we characterized it using SEM. Then IR was used for characterizing this drug. DSC again was used. Then the water vapor transmission and oxygen transmission rate through this membrane was evaluated because that is very important. Like a moist wound will uh, heal faster than the dry wound actually, and oxygen is also required for the proper healing of the wound. So that was found out. Then this, as I said, the antibiotic was added to this membrane. So the release of that antibiotic was evaluated, and what is the kinetics of the release that was evaluated. Then the mechanical properties, like it should have enough strength, so that was evaluated. Then again, as like since it is an antibacterial agent, like antibacterial activity of this ciprofloxacin also was evaluated. So this is how it is going to be. And the method which we used, you will be knowing about it, that is the electrospinning apparatus. This is how this electrospinning apparatus is. It's a easiest method for producing membranes, polymeric membranes having nano and micro sized pores, and also the fibers which constitute this membrane, that diameter can also be regulated. Like if you want in the nano size, you can make it like that, or if you want in micro size, you can adjust the conditions and get the micro sized fibers. So the flow rate, you will be knowing, like you will take the polymer and then you will fix it there, and the flow rate can be adjusted, like how it will be, it is falling into that drum. Then the voltage applied can be, all these things can be looked into the literature and finalized. Then the time, the temperature, distance from the collector, then the viscosity, surface tension, etc. has to be looked in before finalizing the polymeric solution. And then we can optimize to get fibers of the desired properties. And this technique can be used for both the types of synthetic and biopolymers. So here we have used for polyurethane as well as gelatin. So we developed first gelatin membrane, and on top of that we coated this polyurethane membrane. So this is the SCM characterization. The first one is that of gelatin, and second one is the polyurethane membrane. The diameters of the fibers are shown, that is 190 to 1500 nanometer diameter of the fibers are seen in the case of gelatin layer, whereas 200 to 3000 nanometer diameter is seen in the case of polyurethane layer. And it is having this porous structure, which is very, very important for wound healing actually. So this top layer of PU provides suitable mechanical properties and waterproof capacity to the bilayered membrane, and which avoids the bacterial infection and controls the gas exchange between the wound and the surrounding membrane. And the first one is the infrared spectrum of ciprofloxacin. And also we can see that the characteristic peaks of ciprofloxacin is seen in both the membranes. So that means it is distributed, it is confirmed that it is distributed in the both the membranes. And also DSC and TG was also evaluated to confirm the properties of this drug. Then it is important that we study the water absorption of these different layers independently and also as the bilayer. So we can see that the left side is the water absorption of polyurethane, gelatin, and the bilayer membrane. All the membranes are showing considerable amount of water absorption, which is again a good property for wound healing. And the right side is the degradation profile. As we can see that the degradation, the mass loss is very less for polyurethane as expected since it's a synthetic polymer. For gelatin, it is even more higher. But when it is a combined form, it degrades faster. So that is also one important parameter which is required. Then we check the how the drug is released. Cumulative drug release of the drug release of ciprofloxacin for the three layers like gelatin layer, polyurethane layer, and the bilayer for almost 9 hours. And we can see that it is having a almost comparable rate of release of ciprofloxacin in the case of all the three membranes. And also, we evaluated the water vapor transmission rate of this membrane. Which was found to be 1172 gram per meter squared day, and which is good for, as per the literature, it is it's a good value for like wound healing material. And also, it is having oxygen transmission rate of 43.54, and this high value of oxygen transmission rate will promote rapid epithelialization and enhance the wound healing. So if you study the like kinetic parameters of the drug, we can see that it is falling in the category of zero order. That is, a sustained release of ciprofloxacin is found, and also it comes in that is Kosmeyer-Papas model of drug release also it is satisfying. That is, it is having an N value of greater than 1. That is the last column. It shows that this drug release is non-Fickian. Non-Fickian drug release is that it not only depends on the amount of drug, it depends on the kind of matrix from where the drug is releasing. So that kind of a release kinetics this ciprofloxacin is showing. And also, as I said, like along with the degradation property, one another property which is important is the mechanical strength. This membrane should have the enough mechanical strength to act as a barrier. So different parameters like tensile strength, elongation at break, all the properties of gelatin layer, polyurethane layer, and the bilayer was compared. Like we found some amount of change in the elongation at break because like as we can see, the polyurethane layer is having a in the dry condition is 404 and gelatin layer is 24. But for the bilayer, it is showing value which is similar to gelatin. So what we thought was like when it is in the dry condition, it doesn't have much of elongation, but the value is low. Whereas when it is in the wet condition, because of the presence of gelatin and polyurethane, that combined the synergistic effect, the value is increasing to 165.47. And again, since we are planning it for wound healing, we tried different the antibacterial activity on different gram positive and gram negative organisms at different concentrations, and we found considerable zone of inhibition, which indicates that it is a good antibacterial material. So the conclusion is that electrospinning was used to produce bilayer wound dressing membrane composed of polyurethane and gelatin containing ciprofloxacin. Some analysis, FTR studies, and thermal analysis was done to characterize the bilayer membrane. Water permeation and oxygen permeation test was conducted to check the barrier properties of the membrane. In vitro release kinetic studies was conducted to check the release pattern of the ciprofloxacin, and this diffusion studies show that membrane is antibacterial in nature. Coming to the last section of this session, that is the development of hemostats. Actually, hemostat is a membrane which prevents the blood flow actually. So we have developed, actually this section is actually a product development program, which is a very extensive study, but I have not included all the informations here because it will be very boring actually. But it includes a very extensive study that, as I told earlier, like the stability evaluation, etc. Was conducted. So I'll just explain how this product was developed. Like we developed gelatin as well as chitosan hemostats for surgical applications and trauma care. So first I will explain about the trauma care. That is, worldwide, road traffic injuries are the leading cause of death among people, and it is the second cause of death for those aged in the younger category. And in India, annually, more than 1.5 lakh people die due to road accidents. So cotton bandaging is the usually used one, which is not suitable for profuse bleeding, and the removal of which will be very painful. So biopolymers are used. So already available different types of hemostats are there, but in India, not many are available. Like hemostatic devices available in the developed countries is Hemcon, Traumastat, QuickClot, etc. And in India, like there are not many products available. So how this hemostat is made? Hemostats are made from biodegradable. Here I am explaining it based on chitosan. So biodegradable cationic polymer such as chitosan, which has an inherent bioadhesive property. These polymers can effectively bind and agglutinate RBC with the non-specific binding to cell membrane. So it will start the clotting of the blood and will stop the bleeding. And once chitosan is used, like if you use saline, this can be easily removed also. The source of chitosan is the crustaceans such as shrimp, lobster, crab, etc., which is very easily found in Kerala. And this is another like hemostat that is made of gelatin. Gelatin, as I explained earlier, is extracted from the like bone, that cartilage, etc. And this can be purchased from different companies. And after that, we need to make it into a foam. Like we need to beat it and make a form of gelatin, and that gelatin can be poured into different molds and it can be lyophilized. A process called lyophilization will be done, wherein that material will form into a solid sponge kind of a material. So you will be knowing this lyophilization is nothing but like wherein the water part of that solvent will be, or any solvent will be made into the vapor form without going into the liquid form, so that that initial whatever was the condition will be preserved. So here in this case we are making a foam and we are putting it in the lyophilizer. So once after the lyophilization, you will get that foam as such solidified. So it will be having n number of pores inside that. So once it is put into the wound, like that blood can be easily absorbed. So it is found, it is a generally accepted material. This gelatin is the highly accepted material for blood absorption, even by US and European countries. So this is the equipment which is used for making this large amounts. So a small size life laser you must have been seen. So this is actually a large scale pilot scale life laser with having trays and all. So there you can keep different molds after pouring this polymer, and then you need to optimize the conditions in such a way that you will get that. I have shown that picture of that hemostat. It will be sponge kind of a material, and that all this process has to happen in a clean room actually, because it's going to be in contact with the blood. So this whole process has to happen in a very clean room, highly maintained room, and then after that you need to pack it and we need to do the gamma sterilization. That gamma sterilization is done generally in Bangalore and Bombay and all. I think in Kerala it is available in Rubber Institute something somewhere. So after the sterilization, like you need to do the test. Like as I said earlier, different characterization tests. Characterization test as means like the blood absorption test, water absorption test, the strength analysis, then hemolytic test, that whether it will damage the blood or not. Then different preclinical tests, like whether since it's going to be used on the skin, whether it will irritate the skin or not. All these tests has to be done, and that test has to be done in a certified laboratory actually, because we need to provide this. Actually, this is of not much importance to you, but I'm just explaining it. Like once after the development of a proper product, you have to document all the things, get the tests done in authorized laboratories. Then all those documents we need to submit to the regulatory authority. Like now it is DCGA. Earlier and all, we could submit in drug controller of Kerala also. But now everything is centralized. We need to send all the documents to the New Delhi. So they will evaluate it. There will be a group of doctors and scientists. So they will evaluate and they will send the queries. There will be online meetings, or we have to go there and explain. And some reports they will ask. So all those things we need to submit. Once they are okay with that, they will give you the permit to produce this product. And any change in the production, like all the developing methods, etc., should be properly documented. And if you change a small amount of that method also, you need to inform them and get their approval. So these are all very tedious process. Like we can just say, like coming from academic background, you will just develop the prototype. You will think that it's done. But it is, the main thing is that, like, since it's a product which is going to be used in humans, the first thing is the sterility. It should not it should not happen that it is non-sterile. If once it is non-sterile, then it will create big problem. Then second thing is shelf life. It should have enough shelf life, at least 2-3 years. Otherwise, no one will purchase that, because we don't know when we are going to sell it, right? So if it is going to be, the shelf life is going to be for 6 months or something, then no one will be interested in that product. So that is one thing. Then this getting this clearance, then this packing materials. These are all the big hurdles in developing this kind of, and it requires huge amount of investment also. Because for doing all these studies, because these analysis and all, actually we can do in our laboratory. We have animal house, so we can do, but that will not be acceptable to the regulatory authority. If you want to submit, you have to do it in NABL accredited proper labs. So such studies will be very, very costly actually. So these are all the hurdles in developing products. So this is the porosity which was evaluated for this membrane, and this is the water absorption. Like as per, there is a standard, this much of water absorption has to be there. Then blood absorption, that is 35 times its weight of blood it should absorb. So all those things were passed in this case. And this is actually, the first is the skin irritation study in albino rats. It was found non-irritant. This is the study which we conducted in our laboratory. Then figure 5 shows the skin sensitization test on guinea pig. Again, there was no skin sensitization. So this passes the studies. And also how it is used. Like this is a wound site where you can just put that sponge material in saline and just squeeze it and then make it wet, and then you put it in that wound site and just leave it. So it will degrade itself actually. So this gelatin hemostat is mainly useful for surgeons. Like during surgery and all, there will be lots of blood flow. So this can be used for removing that blood, and also you can keep it there so that if little bit of blood flow is there, it can arrest the blood flow. So this product we developed actually in HLL. This is the same case with chitosan, the same thing actually. Only thing is that it's a different material. So I'm not going into the details. So thank you. If any questions, you can ask. So in the second session, I will mainly discuss about the drug delivery things, mainly drug delivery from microparticles for anemia treatment, and also some new forms of drug delivery device such as microneedles. Microneedle, that's actually a new area of drug delivery. So that I will discuss in the next session. Actually, hemostat is used for stopping the blood flow. Hemostat itself means that. So it can be of like polymeric material, mainly polymeric material, like chitosan and gelatin, because all these polymers, chitosan and all, has inherent bioadhesive property actually. So once it is put it in the blood, no, it will coagulate. It will start coagulating blood actually. So that kind of a property it has, because chitosan has positive charges. So that helps in that. So hydrogen means, generally hydrogen means it can be of any material, but that could be used for many, many applications. Like in the eye, we use hydrogen. That liquid which we use now for lubrication, that is actually HPMC, hydrogen, but in the liquid form. like hydrogen means it will have viscoelastic properties. Like elastic property also it will have, viscous property also it will have. The application which I explained, no, that is for articular missing. For that, you need to have elastic property because it has to bear that weight. So it should be strong. That what that viscous property. Start it. So in this second session, I will be mainly dealing with different drug delivery, uh, like microspheres for drug delivery, then microneedle systems for drug delivery, and also some orthopedic membrane. That is again comes under drug delivery. So first I will start with the development of mucoadhesive microspheres of ferrous sulfate with enhanced bioavailability for the treatment of anemia. This is actually a project which I received from SCRB. So this project got over 2 years back. So I'll be discussing the details of this project. രണ്ട് രീതിയിൽ അനങ്ങുന്നില്ല. ഇത് തന്നെ മതി. Okay. So the hypothesis of the study is that frequently used iron supplements has side effects. We all know that the iron supplements creates gastrointestinal intolerance like nausea, vomiting, constipation, diarrhea, etc. And this is very difficult for pregnant women and children. So for them, discontinuation of iron therapy is high due to this mentioned side effects and unpleasant taste of some of the oral iron preparations. And the reason why these side effects are seen are that uh, an amount of iron that is given to the body remains unabsorbed in the intestine, and it creates irritation in the intestinal lumen, leading to this nausea, constipation, etc. So that means the bioavailability of iron. Bioavailability of a drug is nothing but like when we take a drug, like this value gives an idea like how much of that taken drug is absorbed to the body. Like if iron is given into a patient, like maybe some 50 percentage of iron will get absorbed to the body, and the rest 50 percentage will create all these side effects. So it is very important that bioavailability of a drug is high. So the idea is to increase the gastric residence time of the food or the drug in the duodenum. The duodenum portion is the place where this absorption of iron happens. And for this, a property called mucoadhesion is used. That is mucoadhesive microspheres. That is mucoadhesive polymeric microspheres exhibits prolonged residence time at the site of application, and it facilitates an intimate contact with the underlying absorption surface. That is, it remains there at the absorption site for a considerable longer time, and hence the absorption to the body is increased. That is the idea which we choose here. And it can be seen that this is actually the mucus layer. When like microparticles containing the drug comes in contact with this mucus layer, very large particles doesn't get trapped in the mucous membrane. It gets escaped, and the particles of less than 1 micrometer generally gets trapped, and it remains here close to this epithelial cells, and it gets absorbed into the body. So it happens only for the drug which is covered with a mucoadhesive polymer. For the normal drug, this kind of adhesion doesn't happen. That's why it creates irritation to the body. So it can be seen that particles less than 1 micrometer is absorbed more readily. Hence, our objective was to prepare particles of less than 1 micrometer for ferrous sulfate for anemia treatment. So iron absorption is more efficient in the duodenal and proximal segments of the small intestine due to the large number of transferrin receptors found in the duodenum. Hence, we chose three different mucoadhesive polymers such as chitosan, carbopol, and HPMC. These three polymers were chosen, and we coated the ferrous sulfate, which is very cheap actually. We coated it using an equipment called spray dryer. A spray dryer is an equipment where you can spray this solution into droplets, and it will get dried up into different size particles. There is a membrane which is present in the spray dryer, and depending on the pores present in the that membrane, you can spray like nano-sized particles, micro-sized particles, etc. And depending on the smaller the size, the higher the cost of the equipment. So one of the advantage of spray dryer is that you can make large quantity of these particles very easily. Uniformly, you can get. Then this mucoadhesive polymer coated iron will stick to the duodenal wall for comparatively longer time, thereby increasing the absorption of iron, and consequently it will decrease the unabsorbed iron and hence less side effect. This was our hypothesis, and we checked it and we found that it works. So first what we did was the drug, that is the ferrous sulfate, was mixed with these different polymers in different ratios. That is the first test we do for this kind of drug delivery applications. And we tried the compatibility studies. Like we will keep this like mixture in a stability chamber for some 2-3 months, and we will take it up and analyze the drug. And then we will see, because of this polymer, is there any problem or degradation happening to the drug. If there is a degradation happening to the drug, then we will not proceed with that polymer. And this test is generally conducted using like DSC. DSC of the material will be checked. Then IR will be checked like that. Then once that compatibility test is passed, then we will go for the spray drying, and we will get different sized particles. This is an example of micron-sized particles SEM image. And we conducted different characterization as usual, like SEM, IR, etc. Then we will find out the encapsulation efficiency that has to be optimized. That encapsulation efficiency has to be sufficiently higher. Then in vitro release, like how this is, whether it will have a burst release or it will have a sustained release. That is very important, because if it has a burst release, it will not be that useful because it will just release very quickly, leading to tone absorption to the body. Then mucoadhesive tests are there. Then followed by, as usual, like cytotoxicity analysis, etc. So this is the spray dryer which we use. So this is the like some preliminary studies we did for the in vitro mucoadhesion studies. That is agar mucin gel. Like mucin is actually like represents the mucous membrane, whatever is present in the intestine. So we will coat that on this glass slide and we will dry it. It will be in a semi-solid form and we will drop this ferrous sulfate and the coated thing. And we can see that like ferrous sulfate, which is coated, actually it is not very clear here, but when we actually see, we can see that ferrous sulfate, whatever is there, it just flows quickly, whereas the mucoadhesive particle sticks to the muci. And the same test was done using isolated goat intestine. Like we purchased this goat intestine and we placed like same amount of particles here, and we allowed to pass saline solution at a fixed flow rate, and we calculated the number of particles whatever has come out to this particular point, and we calculated the mucoadhesion. So we found that HPMC is not having much mucoadhesion, whereas chitosan and no, carbapol and chitosan and HPMC combinations are showing reasonably good mucoadhesion. So we chose these two materials for further evaluations. Then we did some ferritin uptake studies. Ferritin, you will be knowing, like gives an indirect information about the iron present. So how much of ferritin is uptake into the CACO2 cell lines? CACO2 cell lines are the cells which is present in the duodenum, which is responsible for the iron absorption. So we purchased these cell lines and we studied how much of ferritin is uptaken into the body. And we found that like there is like almost all the cell lines are showing almost same amount, but there is some amount of difference in absorption depending on the time. That is, when the time was increased to 4 hours, there is slight increase in some cases. Otherwise, it is the same. Again, like we did the acute oral toxicity studies, which will give the effective dose and the lethal dose of this formulation. So there are some calculations. Again, these are all like detailed studies. The efficacy studies was done. Phenylhydrazine was used for inducing the anemia in the rat. And we gave this our material and we evaluated the blood parameters. Again, that is a very long study. And we found that the efficacy is better for our formulation. And also in vivo bioavailability, that is pharmacokinetic studies was also done. Again, that also showed very good as compared to just ferrous sulfate. And we did the stability evaluation also for 6 months. So we could see that this is the SCM image of 0th month and this is the 6th month. We didn't see much of difference in the particle size. Slight agglomeration was only observed. Otherwise, the particle size remains the same. Even the release of ferrous sulfate was also almost the same up to 6 months. So this formulation was found to be stable. So the result is that carbapol ion formulations were found to be having the most mucoadhesion, in vitro ferritin uptake, and cytocompatibility compared to chitosan ion microspheres and HMC ion microspheres. We tried 3 formulations. Out of that, carbapol was found to be the best. And in vivo studies were done on rats, showed no oral toxicity at therapeutic dose and improved bioavailability and efficiency compared to ferrous sulfate. This actually, as I said, like was done using the SCRB funding. So we are applied for a project for the next phase, like large scale studies and preclinical evaluations. So the next work I'm going to present is nanofibrous. Again, it's an electrospan membrane, antibacterial membrane used for dental applications. Like here I will explain. Like periodontitis is one disease which is commonly found among elderly people. That is, in the tooth, there will be accumulation of plaque. Then it will lead to some kind of inflammation. And what happens is that, like, it will lead to the loss of the teeth if it is not properly treated. So, what happens is that generally dentists, what they do is they clean this portion, that there will be accumulation of pus and etc. So that will be cleaned by the dentist, and they will keep a membrane here. The purpose of the membrane is that, like, that some amount of time should be given for the regeneration of the bone actually. If you compare this is actually epithelial cells. So these cells can be regenerated very fast. Whereas bone regeneration is little difficult and it takes more time. So what will happen is, if you don't give this membrane, what will happen is that, like, this portion, this epithelial portion will grow into this teeth, that bone portion, and this bone will not heal properly. What will happen is, after some time, this bone will be lost. So that is one common thing which is found. So for that purpose, as of now, people are using collagen membranes. Collagen membrane is actually highly biocompatible. It is prepared from the, like uh, uh, like I said, gelatin. Like, it is prepared from this bone, etc. So it is actually of bio origin. So it will be very highly biocompatible. But the problem is that it will not have enough mechanical strength. So it will degrade very quickly. So the purpose of keeping this membrane will not be met. So some people use synthetic membranes also. Again, the problem is that synthetic things, or things which will not degrade if you put it there, like, you need to do one more surgery to remove that membrane. So in such cases, biodegradable membranes are of very importance. That means biodegradable membrane will be provide this barrier, and but it will degrade also itself, which is called the guided tissue regeneration. Like, you are guiding the material for regeneration. That is actually a altogether a different topic, like, wherein, like, you will provide some kind of a barrier and will allow the material to, like, regenerate. Again, for that purpose, we have chosen polycaprolactam and gelatin mixture. The reason for choosing this kind of mixture of synthetic and biomaterial, like gelatin, is that, like, gelatin has highly biocompatible nature, but it doesn't have strength. Whereas polycaprolactam has enough mechanical strength, but it is of synthetic origin. So if you mix these two things, you can get mechanical strength, as well as the degradation also will happen. So that is the reason many such studies have been done, wherein this kind of combinations people use, so that you will get the enough required mechanical strength, but it will degrade itself and without any toxicity. So PCL is again one highly, like, FDA approved material, so that, like, you can use it for any application. So this is made using a core shell electrospinning technique, like, where we have tried both the ways, like PCL outside, gelatin inside, and gelatin outside, PCL inside. Both the ways we tried. And we have added one GSNO, that is called the nitric oxide complex, which has actually an antibacterial and wound healing property also inside the core of the core shell electrospun membrane, so that it effectively cures this dental portion. So this is the, like, we have condition we have chosen, like PCL alone we did the electrospinning, then using different combinations P1, this is 10 and 4 different ratios we have chosen, conductivity, viscosity, these are all parameters which generally we measure before electrospinning. And this is the GSNO, that is nitric oxide complex, which is required for antibacterial property. And these are all the STEM images showing different sizes, like this contains nitric oxide. So all these membranes were chosen. And as I said, one of the main parameter we checked here is the degradation. That is the mechanical strength and the degradation. So when we checked with the dental surgeons, what they told was like it should degrade within say some 2 to 3 months. It should degrade for 2 to 3 months. It should stay there, and slowly within that period it should degrade. That is the best thing. So we developed. We found that we found that PCL alone doesn't. This is actually after 28 days. After 30 days, we could not analyze the SEM because all the membranes were like broken. So 28 days we could analyze the SCM. So here we can see that PCL alone doesn't degrade much, but the other membranes are degrading. This last one is the one which contains GSNO. This is also like degrading slowly. So here we could see that like it is degrading slowly, like all the four membranes are degrading, and this is a membrane which contains the drug. So it is like almost like up to 50% of degradation is happening for this within 50-60 days it is happening. So we found that this material could be used for guided tissue regeneration. Stuck time. So this first one is the membrane, the electrospan membrane, and right one is the membrane having that fibers we can see. And we tried since we are planning it for wound healing because dental wound healing, like we tried SP aerogenesa, which is found in the mouth. Then as aureus was also tested, and it is found to be satisfactorily meeting the condition of antibacterial activity. Then we tried like mechanical properties, and it was found to have sufficient strength. And also we tried we calculated the Young's modulus of these membranes, and as expected, PCL membrane was having the largest value of Young's modulus, and whereas the other membranes were having like comparatively smaller values. Then we did the skin sensitization. Like this was done using our membrane, and it was found that there was no skin sensitization. And this is actually the acute toxicity. Acute toxicity is nothing but when you provide this membrane to an organism or a rat, like whether the kidney or the liver, heart, etc., are functioning properly or not. That is what is called acute toxicity. So here we can see that the histology of kidney, liver, heart, etc., and there is no problem with the kidney, liver, and heart histological images. This analysis was done by a pathologist actually. This work was done in collaboration with the Pushpagiri Institute of Dental Sciences, Tiruvalla. Then they did the subcutaneous implantation because this has to be implanted into the human body. Before that, this kind of subcutaneous implantation was done. Different like cells, different tissues were taken out at different weeks, week 1, week 2, week 3, week 4, and it was found that there was no problem with the tissues as compared to the control. So the subcutaneous implantation also was passed. So this is the last piece of work which I'll be presenting here. This is actually, again, drug delivery. It's a recent topic actually. It is called dissolvable microneedles for the rapid delivery of drugs, development and evaluations. Coming to, I'll give an introduction to this. That is, generally, drug delivery routes are of two types. One is oral route and another one is parenteral route. Parenteral route is nothing but the injections. So the oral route is like, like it has the dose is previously determined. Like you have different tablets and capsules, like it will have a particular dose. So we don't need to like decide anything. We just have to take it and consume it. So the advantage is that like it can be the portability is there. Like, and you can carry it anywhere. Like, unlike an injection, this can be carried. Then patient self-administration, which is very, very important because you don't require a medical practitioner for providing this. Uh, but one of the problem is that some drugs, like some therapeutic peptides, or which are not stabilized in the food tract, that such kind of drug cannot be given through the oral route, and because they rapidly degrade in the stomach. Whereas for injection, that is the parenteral route, the primary mode of administrating macromolecules is through injection. And the main problem with this that it is highly effective, but the problem is that it is invasive, like it is painful, and you require a doctor for giving this. So both the methods have some advantages and some disadvantages. So one of the alternative mechanism which people are thinking is microneedles. Microneedles are like, this right side, whatever. This is actually a microneedle patch. This will be having array of microneedles. We cannot see it very clearly, but when we closely look at, we can see some micron-sized needles. So it will be containing drug. So there are I will compare this microneedle with other drug delivery systems. That is topical cream. Topical cream, we know, like some oil and all we'll be applying, no, but that will be highly ineffective. Like whatever the drug we give, out of that maybe 10 or 20% only will be absorbed to the body. The reason is that only certain types of molecules can pass through the skin, because lipophilic molecules only generally passes. So that is why it is given along with the oil formulation, so that it passes through the skin, because the outer covering has the stratum corneum doesn't have too many pores. So most of the drug will be lost. The hypodermic needle, that is the proper injection, which is very effective, but it is painful. Whereas transdermal patch is also there, but that also like has to cross this stratum corneum, which is like a very strong barrier. Whereas this microneedle patch, these are all like numerous number of microneedle patches, which will effectively pierce this outer stratum corneum and epidermis, and it will reach near the dermal region. So advantage is that it clearly crosses these barriers, and also it doesn't touch the nerves. These are the pain receptors. So since it doesn't touch the pain receptors, it doesn't cause pain. And also it reaches from here, like the blood vessels also starts coming. So this can be easily absorbed into the bloodstream. So that is one advantage. So the advantage is that large molecules which are not penetrating through the cream can also be administered. No fear of needle, painless administration, ease of administration. Anybody can just put it on the skin. Then good tolerability, because generally erythema and oedema, that is a term which is defines the skin irritation. That is not seen in this case. Then less chance of microbial contamination, because whatever pores are formed, that gets closes very quickly. Then local delivery of drug is possible. Suppose if you have problem in the skin, you can put this injection there itself. So there are different types of microneedles. One is the first one, which was introduced a long back, that is solid microneedle. That is microneedle developed using the stainless steel. So what happens is that stainless steel microneedles will be put on the skin and it will be taken out. So there will be pores. Then you put the cream. Whatever drug will be put on that place and the drug will be taken. So that was the initially developed microneedle. Then drug-coated microneedles were developed. That is, on top of this, drug will be coated. So once you put it in the skin, the drug will be going to the skin. Then hollow microneedle. This is generally developed for delivering liquid drugs. So liquid drug will be filled in this, and once after putting it, that drug will be coming out of this. Then the recent developments are dissolvable microneedle and hydrogen-based microneedle. So these two type of microneedles are like highly discussed these days, because dissolvable microneedles, as I said earlier, like it will just, there will be a liquid called interstitial fluid in this portion. So as soon as this microneedle comes in contact with this liquid, it will slowly start dissolving, and the drug will be released so that you don't need to remove anything from that site. Then hydrogel-based microneedle is like once this needle comes in contact with the interstitial fluid, it will swell and form a hydrogel. So the drug will be slowly releasing. So these are the two important areas. And I'm working mainly on this. This also I'm working on for a different application. For drug delivery, this I'm using. This all of the material. So one of many applications are there, like cellular delivery. Even cells can be like delivered to the site. Insulin can be delivered because insulin you need to give every day, no? So since it is painless, it will be of use. Then vaccine because like on the skin there are lots of that immunal cells are present, which will react quickly to the vaccine. So skin is one important area where vaccine delivery is possible. Then this is one drug actually. Then protein vaccine. Then transdermal drug can be given. Then tissue, systemic delivery. Then microneedle skin therapy is also possible. Actually, this is one very like acne treatment and all. Like you have there is something called derma roller. Roller is actually available in Amazon and all. Like it will be a roller kind of a thing having these needles. So when you put it on your skin, this pores will be formed on your skin. Then you put the hyaluronic acid. So it will get absorbed very quickly and that collagen formation, etc. happens very quickly. So anti-aging for such applications, it is very much in demand, especially in Korea and such countries. So here, actually, I will not be disclosing all the things because it's an ongoing project, actually, I funded by ICMR. This is actually a drug incorporated in the dissolvable microneedle made of biopolymers. So first we evaluated different polymers for the development of the microneedles. Then we developed the microneedle, then characterization, etc. So how we develop this microneedle? There is a mold called PDMS, polydimethyl siloxane mold, and this can be purchased. We can make it also, but we purchased it because we wanted very proper dimension, etc. We wanted, so we purchased it, and we purchased this kind of dimension. Then needle height was 600 micrometers, and then this is actually the cross section of the mold, and we can add polymer solution into it. Then vacuum can be applied, or we can do centrifugation so that it goes into this thing. Then we can keep it undisturbed for some time. Then the whatever residue is there, you can remove it. Then we can add again material. If you want, you can add drug. Then again applying vacuum. Then drying at 40 degrees Celsius. This temperature will depend on our choosing of polymers. Like depending on our polymer, we have to choose this drying condition. Then after a particular time of drying, you can just tap it, then this microneedle will come out of it. It will be a flexible material. So here we have chosen hyaluronic acid, then polyvinyl alcohol, a blend of polyvinyl pyridone, like 10 bar 360, because that combination gave very good microneedle. We initially tried different concentrations. Then first we did was rheology analysis. As I said earlier, like this polymer, it is very, we want to know like how easily it will fill into that mold. That rheological parameters of polymer, like viscoelastic properties are very important. And the drying condition, the curing temperature, etc. we wanted to know. So first we did the rheology analysis. First we did the amplitude sweep, like how that strain, how it is coming. We found out the viscoelastic regime. Then we did the frequency sweep and for different concentration of HA. And we found that dilation point occurs at lower frequencies with significantly higher modulus for hyaluronic acid. This is for different. Thereby, we wanted to see like how much of handling time we can get before getting that dilation, before dilation happens. Then PVP 1060 also dilation point occurs at higher frequencies in this case with a significantly higher modulus. The modulus values are higher. But in all the concentrations of PVA, this is actually PVA. Here we found that Low's modulus is higher. Here the stability was not there, but viscous parameters were more. Shows viscous parameter. Hence, we didn't choose PVA further. Then the complex viscosity analysis was also done. In the case of HAPVA, the complex viscosity is found to decrease. That is, the shear thinning behavior is found. And PVP 10 bar 360 viscosity shows sudden decrease and increase at lower frequencies and then maintains at a in higher frequencies. So this is the complex. Then flow curve was also drawn. All the concentrations, they don't show any hysteresis, so this could be easily used. All the concentration shows shear thinning behavior. And this is the temperature dependent. So we wanted to check the curing temperature and we optimized that at 25 also it is fine, 40 also it is fine, but by 16 the curing has started, the viscosity started increasing. So we optimized 40 degrees Celsius for curing. So these are the SCM images of the microneedles. This is how it looks actually. When you see through SCM, like the size, if you analyze, it will come around 600 nanometer, etc. Because that is the height of the microneedle, what we mold we chose. You can choose any type, like 1000 micrometer, up to 1000 micrometer or 1500 micrometer. It will not create any pain. We can also, no need to go for SCM also, since these are all micron sized, you can even analyze using normal stereo microscope. Then this was one skin mimicking study which we performed. That is parafilm. Parafilm is generally considered as a skin mimic actually. We will fold it 8 times to get skin kind of structure. And we will I think there's an equipment called texture analyzer. You put the microneedle and apply particular force. It will go and punch that skin. So we will see how many number of holes are being formed. So we saw that PVP and HA are found to be good in forming forms up to holes up to layer 3. That means it has that penetration ability. Actually, this is just an in vitro test. The same test has to be done on porcine skin also. Like we can get the skin and using a textile analyzer. Like this will be put on that, and we can see using like optical imaging. Some dye will be put on that. So we can see that blue color like holes formed on the skin. So this is again like texture analyzer. Like we have given different forces, 5 Newton to 10 Newton and 30 Newton. So up to 10 Newton, we can see that only some tips are bent, whereas up to 30 Newton, like the tip is fully bent. So up to 10 Newton force, it is like holding. It is holding without any change. And drug release also we study. We saw that within 2 minutes itself, like about 40% of the drug is released, so that it can be used for a fast release of the drug. For faster applications, it could be used. And this is the cytotoxicity conducted on fibroblast L929 cells. Like the cells are, all the type of microneedles are found to be biocompatible. And this is actually an animal study. The first one is that in vivo skin insertion test. Like this is actually rat skin. And here, like, we have put the microneedle. And after a particular time, I think this is for 2 minutes of application. We tried different types of application. We applied this blue color dye and we took the photograph. So here we can see that pores are formed. Then this is the microneedle. After application, we took it out and we lyophilized it and we analyzed using SCM. So we can see that thick portion is gone. That means it has dissolved within 2 minutes itself. And that skin portion, again, we gave it for histopathology and we could see this kind of things, like, insertions. This, and after 24 hours, we can see that these are like resealed. Like that whole whatever is formed is resealed. And we also saw the irritation, like within 5 minutes, there is pores, 30 minutes also it is there. But within 24 hours, with whatever pores are formed, like it is resealing. You can see it here. And it is creating no skin irritation. So the conclusion is that this study demonstrated the successful fabrication of misoprostol. That's the drug actually we chose for dissolving microneedle patches. And it exhibits a sharp morphology, which we could see using STM. It efficiently penetrates the skin, ensuring the immediate drug release. Because from the drug release study, we could see that it was releasing within first 2 minutes itself. Then the reversible damage only is happening. It is very minimal. And this suggests that this microneedle could be used for convenient and acceptable drug delivery of in critical conditions because it releases very quickly. So, like if it is interesting, this is not my work actually. This is just for information. Some studies are there where cryomicroneedles, like the microneedles will be made of like ice. The reason is it will be having like live cells on it. This kind of studies are happening because when this is actually a cardiac cell integrated microneedle patch for treating myocardial infarction. That is, when this heart attack happens, some amount of cells in the heart will be lost actually. Death of the cells happen. So in such cases, generally what people do is some direct injection or some surgery or such things happen. But in this case, again, surgery will be required in this case also. But microneedle patch containing stromal cells will be grown in the lab and it will be transferred into that particular area. And this green suggests that grown cells. Like the details are present in this article actually. I have not included all the details. So such kind of studies are there. Then as I said earlier, vaccine can be delivered. Like dermis has a rich supply of blood and lymph vessels. It is exposed to various types of immune cells such as antigen presenting cells, Langerhans cells. All these cells are present in the dermis actually. So if you give this vaccine to the skin, it is highly efficient actually speaking. So such kind of studies are going on widely throughout the world actually. Some studies have gone up to the clinical trials also. That is vaccine delivery through the skin using microneedles. But none of the drug has got um, permission to market. But studies are going on actually. So this is one thing which is fully developed. Again, they have not got the permission. Soluvia was the first intradermal vaccine developed. Some corona vaccines are also being developed. Like many studies are happening. This is one very active area. Then this is one area where I am working. Like as I said, I am having two projects. One is funded by ICMR, that is for drug delivery, and this project is funded by SCRB. This is for diagnosis using microneedles. So the idea is that, like earlier I told no about hydrogel microneedles. So once these hydrogel forming microneedles are put into the skin, there is this interstitial fluid which is present there. So that interstitial fluid is similar to blood. Actually, whatever biomarkers are present in the blood, this interstitial fluid also has. Only thing is that it doesn't have the RBCs. So when you put this hydrogen forming microneedle on your skin and take it out, since it is hydrogen forming, these polymers will swell and will take up all this biomarker into the microneedle. So you take that out and like separate that whatever biomarker is present in that hydrogen. Then you can analyze using any technique like colorimetry or ELISA method. Like that, you can analyze whatever is any drug disease condition is there or not. Like that, some cancer detection is possible. Then many kinds of mainly cancer detection. Such detection is possible actually. So interstitial fluid holds great potential as they effectively collect target biomarkers. Uh, ISF is formed by capillary filtration through blood, and hydrogen forming microneedle patch has great promise, and it can be sampled and without damaging the blood vessels. So without any pain, you can take out this liquid and analyze it. That will be an invasive method for diagnosis. So this is again one like you put insert it, take it out, then you put it in a beaker or whatever and dissolve the polymer away, take that and analyze it. Analyze it using any technique, maybe fluorescence, maybe what is what voltammetric methods or ELISA methods. paper colorimetry. Sometimes paper will be used, no? Like to see the biomarker is there or not, like that. Because it will be having the antibody, and when it reacts with the antigen, some coloration will form like that. So that is what is shown here. This kind of project we are also doing for sepsis. Like sepsis is one disease which small kids will face when they are born, like neonatal sepsis it is called. For that, we need to collect the blood very frequently. So collecting blood from neonatal patients will be very difficult. So in such cases, method of diagnosis. So this is one SCRB-100 project. This is again one more example from literature. This is the PVA and CS hydrogel forming microneedle. This way microneedle are formed. Then this will be put under the skin. These biomarkers will be taken up. Then you heat it, dissolve the polymer, and take the biomarker and do colorimetric analysis. But there are many challenges. See, none of the products are in the market actually speaking. So the challenges are like different parameters has to be like fixed, like the length, the type of polymer, etc. has to be checked. Then compatibility has to be there. Then load, how much of drug can be taken up. Then getting the reproducibility. These are all small things, no? Then how to make it, because this PDMS molds are very costly actually, because it is in a micro size, so it's very costly. So to purchase them will be very costly. Then safety, some irritation, sensitization, such things should not happen. Then regulatory matters. Since such kind of product doesn't exist in the market, like it will be very difficult. Like they will have to, I mean, we'll have to produce all kinds of data for getting the market clearance. Thank you.
Now, if you have any queries, you can interact with the resource person.
Like transparency will indirectly say about the compatibility of the polymer and the drug. So, like it should be compatible. Transparency as such, it's not a problem. But polymer and the drug should be properly miscible and all. Otherwise, we will not have that uniform distribution. So that is important. Any polymer with the drug, first we need to see whether both are compatible or not. Like if there is an agglomeration or something happening, that means some change is happening to the drug, no? Because if, yeah, at the end of the day, the efficiency of the drug depends on the solubility and all. Like if it forms an aggregate, then it will, the effectiveness will not be the same. So that it should be compatible. Then only we should go for making membrane, hydrogel, microparticles, anything. First, it should be compatible. So transparency, in a way, we say whether it is like compatible or not. Of course, we need to do the testings also. We can, yeah, we can keep it. Then maybe you can put one bandage. We are also actually developing it like that only. We purchase some bandages and put it in there, so that otherwise it is very small, no? It is difficult to handle. Then you put it like that.
As we are approaching towards the close of this enlightening session of our FDP, it's time to take a moment to reflect and express our gratitude. For that, I welcome Dr. Kirti Ji Nair from FISET. Good evening, all. First of all,
I would like to apologize for the inconvenience caused in between the session due to power fluctuation, and also thank you for the cooperation during the. Okay. Now it's come to the duty that bestowed upon me. So it is my honor and privilege to propose the vote of thanks. First and foremost, I would like to extend my sincere gratitude to Dr. Rosemary, Scientist E3 at HLL Life Care Limited, Trivandrum, for gracing her with her presence and delivering such an enlightening session on biomaterials and nanomaterials for healthcare application. Your real-world industrial experience and research perspectives have added immense value to today's session. Thank you so much, ma'am, for the interactive and very informative session. Thank you. I'd also like to take this opportunity to extend my sincere gratitude to Dr. Soni sir and team, that is the organizing committee of this ATAL FDP, for making this event more memorable and very grateful experience for all of us. The hospitality and the the incurable talks was very informative, and we would like to thank you for giving such an experience for all of us. Thank you.
Thank you, ma'am. Now, we would like to hand over a token of appreciation to Dr. Rosemary for this wonderful session. We would like to invite Dr. Soni C. George, our FDP coordinator, to hand over the gift.
So now today's session is over, but we are going to the lab now. Mr. Pranav and Anna will lead you to the lab, and we'll have a lab session. And another announcement regarding tomorrow's session, as ACT has directed us to postpone tomorrow's session. So we will postpone the same to on Monday, on 13th July. So we do not have any session tomorrow. We thought of conducting it online, but as ACT, I requested ACT what to advise us to do, because it is an online adult program. So they wrote to us that postpone to other day. So it is better, we have no option, we have to postpone to Monday. So tomorrow's session will be postponed to Monday. Offline, yeah. Offline, yes. Yeah. Then we can, so there are those who have completed the papers, the article summary can hand over now. And you will also get another one, journal summary paper, that we will distribute on Thursday. So tomorrow we do not have any session as per ACT direction. Thank you all for your kind cooperation.
We may proceed to our lab.
ഹലോ എടാ ഈ ലാപ്പ് കൂടെ എടുത്തത് നമ്മുടെ ഫീസ് മൈക്രോസോഫ്റ്റ്
ലാപ്പ് റെക്കോർഡിംഗ് ആണ്. ലാപ്പ് റെക്കോർഡിംഗ്.
ടീംസ് സൈൻ അപ്പ് ചെയ്ത് കൊടുത്തില്ലേ? ഇത് പ്രണവിന്റെ ആയിരിക്കും. അതല്ല നിന്റെ അതിലെ ടീംസ്